Hello friends, greetings for International Yoga Day. We all know that Yoga Day is celebrated every year on 21st June. This day is celebrated all over the world due to the motivation and efforts of the Honorable Prime Minister Shri Narendra Modi. Please listen this special program, Scientific Basis of Yoga and its Effects. The experts are Dr. Rakesh Yadav, Cardiologist, AIIMS, Dr. Rahul Varshney, Neurosurgeon, RML Hospital, Professor Vaidya Ravinarayan Acharya, Director General, Central Council for Research in Ayurvedic Sciences, Ministry of AYUSH, Government of India. Moderator is Mahendra Singh Lalas.
In this program, we are going to have a panel discussion on the topic Science of Yoga and its impact on our health. We have with us renowned cardiologist Dr. Rakesh Yadav, All India Institute of Medical Science. Dr. Yadav, we welcome you. We have with us Dr. Rahul Varshney. He is a renowned neurosurgeon. He is currently working with Ram Manohar Lohia Hospital. Dr. Varshney, we welcome you. And along with him, we have Vaidya Professor Ravinarayan Acharya ji. He is Director General in Central Council for Research on Ayurvedic Sciences, CCRAS of AYUSH Mantralaya. I begin with you, Dr. Yadav. Yoga is our traditional science in a way, but not many studies have been conducted on its scientific effects and impacts. Do you think that yoga is purely science?
Yoga is lasting from thousands of years. So it has proven its efficiency, whatever you say, but it was transmitted mouth to mouth. In a modern era of medicine, we always want an evidence-based medicine. Is there an evidence which is written? Though there was a lot of evidence, I will always say that yoga has a lot of evidence, but it is not written in a scientific way. Now, after encouragement of the government, there's a lot of recent researches are going on and they are showing positive results with the yoga, whether it is cardiovascular, whether it is orthopedics, whether it is a mental, whether it's a eye, whether it's a neurology, in all aspects. But these researches, the outcome will take time. Suppose you want that while doing yoga or while not doing yoga, there is a mortality benefit, it required 5-10 years of study, and it will be there. The most important thing, if you say that the mango is sweet, it is sweet. If you say what is an evidence, the evidence may not be so much in a robust way, but it is sweet because everybody has experienced it. So everybody experienced that yoga is beneficial, though you are absolutely correct. If somebody says, show me the studies, though there are studies, but they are not large enough. And now I think the research councils, there are a lot of research and the government is encouraging the studies and research. So in near future, we will have ample evidence showing that yoga is beneficial in this disease and this disease.
Dr. Rakesh, you are a cardiologist. Tell me, are there evidences in your personal life where you met someone who was having some heart problems and he performed or he did yoga and he was benefited from it?
There's one thing, yoga may not be curative. There's no medicine in cardiology which is curative. Everything is just a treatment. We treat heart disease, we never cure it if you have a heart disease. So what we say, if you start doing yoga in an early age, you can prevent your heart attack. You can control the blood pressure so the heart failure can be prevented. You have control your diabetes so your cardiovascular mortality.
And this you can say based on your personal experiences as well?
It is not a personal experience. It's evidence-based. We all know that doing a physiotherapy, changing your dietary pattern, sleeping properly, avoiding stress has shown benefit. And there's a lot of ample evidence. So what is yoga? Yoga is your physiotherapy. Yoga dhyan is your mental improvement. Your pranayam is your deep breathing exercises. And the yoga diet is what a diet we prescribe. So it is an indirect evidence. If you practice yoga, then there has to be benefit in all aspects of cardiovascular disease. Even we say the patient who has an heart failure, we have started giving treatment. One arm is advised yoga. We find that those who are doing yoga has much better quality of life as compared to the person who are not doing. I think a lot of studies are going on, but indirectly you can say it has to be beneficial. There's no doubt about it.
Dr. Rahul Varshney, renowned neurosurgeon. Tell me, you come across a lot of persons, lot of patients, lot of people, male, female, children, adults who are having neurological problems. So do you think that our traditional science, including yoga, which includes pranayama as well, samadhi, dhyan, whatever, they can deal with our neuro problems, or they can address them, or they can work better on our neurons?
Yes. First, I would like to tell prevention is better than cure. So if we start our journey from preventive point of view, that will be better rather than going for a cure. So there are various asanas in yoga asanas like Bhujangasana, that strengthens your spine. So if you practice that regularly, then definitely there are less chances that you will get any spinal ailments. Your paraspinal muscles will be strong. And yes, there are quite a few evidence that yoga regulates your hypothalamic pituitary axis, that causes a decrease in your stress hormones. And this stress hormones ultimately calms your brain, calms your heart, regulates your sleep, and this will automatically benefit your day-to-day life. So yes, there are definite evidences and there are researches going on, as sir said, because with this research it has been shown that number of mental illness like anxiety, depressions, the frequency is reduced, the dosage is reduced if you combine your yoga with your ongoing treatment. Yes, there are evidence, research are going on, and I feel that it will definitely help you.
Dr. Varshney, yoga and there are many other modern methods of exercises. Let's say someone who is going to gym, let's say someone who is running, let's say someone is doing some other exercises. Do you think that doing yoga, performing yoga or performing pranayama makes a difference and it is different from other physiological exercises?
That's a very good question. See, whenever you are having some spinal ailments, your cervical, we have chronic fatigue syndromes, chronic pain syndrome. So in that you have to, when you do an isometric exercises, so that will be definitely helpful. But yes, if you stress your body like weightlifting, running, that may be harmful to you. So it is my sincere advice that you consult your yoga trainer and do exercises that will definitely help you out in your disease process.
Professor Ravinarayan Acharya ji, kindly tell me, are there researches, as we all are talking about, are there researches to prove that yoga is beneficial for our body as well?
Yes, yoga, there are lot of researches, but lot of researches are going on, but these are not sufficient. But no doubt yoga is beneficial, and yoga is not a physical exercise. We should not correlate yoga as a mere physical exercise. It gives us physical, mental and spiritual well-being, which is the term in Ayurveda. The purpose of a person is called as swastha. When a person is considered as a swastha, in Ayurveda we have a stanza, samadosha samagnischa samadhatu malakriya prasanna atma indriya mana. So by doing yoga, you are enhancing your physical immunity, you are enhancing your physical strength. At the same time, you are getting good quality sleep, mental stability and also spirituality. Gaining by dhyana, you are getting spirituality. So it is effective in terms of prevention, in terms of palliative care and in terms of curative aspect also.
My question is, are there some researches going on or which prove whatever you have just said?
Yeah, researches are going on by our council, Central Council of Research in Ayurveda. There is another research council, research in yoga, Yoga Institute at our Delhi. Then S. Vyasa, dedicated university for yoga, and other, not only in India but other part of the world, yoga, the different institutes, Patanjali Institute, they are conducting yoga, and now the All India Institute of Medical Sciences, New Delhi, and also other All India Institute of Medical Sciences, they are quite eager and they are working on a lot of researches are going on. We have carried out a research on, you have asked, post cardiac surgery in AIIMS New Delhi. We have added Ayurveda, a cardiac tonic tea, and along with yoga, and we found post cardiac surgery patient is more effective than the control group.
Dr. Rakesh Yadav, Maharishi Patanjali described it as Ashtanga Yoga. There are 8 stages of yoga. Many yoga teachers recently, they have tried to prove that particular asana, particular thing is beneficial in this kind of disease. If you do this kind of asana.
It's a very good question. There's various way the gurus are promoting the yoga. I always say, you have a banana, you have a mango, you have a amrud, guava, everything is there. So if I have to say that which fruit is best, it's absolutely a difficult answer. In some it is beneficial, in some it is beneficial, it causes less constipation, it causes more constipation, it increases the sugar, but it's a complex carbohydrate. So this is just various yogachari is advising, because they all are practicing yoga for a long time. Sometimes it is being exaggerated. I always say, some people say you have a cancer, lung cancer, you go to this yogachari, he will cure it. Absolutely no. What happens if you have a lung cancer, you are mentally depressed, you are not doing any physiotherapy, you are not doing any deep breathing exercises. Once you perform this, your well-being is preserved, your quality of life is improved. So you feel that my cancer is being cured, but absolutely not. So it assists. The yoga in these patients improves your quality of life. If I give medicine, your quality of life is better, then you are going to benefit more. So absolutely, I will never say they are fake. Sometimes they are over exaggerated. I always say that is your intelligentsia that you capture what is important for you. Everybody is promoting because there is some commercial reason also, but it is you have to decide. Yoga Acharya are promoting one thing, give a dhyan. The way of dhyan is different. Do a pranayam. Way of pranayam is different. And do yoga asanas. There may be some variation in yoga asana, but more so ever, they are doing the same thing.
Should that be assumed that yoga doesn't work like an allopathic pill?
No. That is again yoga add on. There is no substitution. There is no substitution for paracetamol. If you have a fever, you perform doing yoga, your fever will increase because you are exerting. So yoga is add-on therapy. As Dr. Saab has said, what is the definition of health? It is a mental, physical and spiritual well-being. So yoga gives 3 packages. Improves your spirituality, mentally and physically. It is a complete package.
Dr. Varshney, we talk a lot about our ancient science and yoga is one of them. There's no doubt that yoga is really science and scientific because all our methods, traditional methods, they have been time tested. But of course, going by the Western modern scientific methods, we have to just empirically prove it. Just tell me that if we believe that whatever has been said over the years, over the centuries, if it is correct, then why can't we deal with modern all diseases with only yoga and pranayama?
As Dr. Saab said, that yoga is supportive. It's not a complete treatment for some things. If suppose you are in a depression, okay, you are taking some medications for depressions. So with the yoga, yes, definitely your dosage will be reduced, but you cannot cure your depression with the yoga. So yoga is only adjunct to the normal treatments. If a patient comes to know that I'm having a brain tumor, so he prefers the last to go to a neurosurgeon. Okay, he tries every bit of treatments. Everything has a good and a bad aspect. So there are few fake people who say that I will cure this by doing this, and they start doing all these things, and when the tumor goes beyond the limit, then they are referred to our hospitals. Yoga is just a supplement. It will definitely help you out, but yes, I think there is no such diseases in which yoga can cure you.
Dr. Varshney, for past couple of decades, you can say that earlier it was like allopathy is a miracle science and everything could be cured with this science, this medical science, this branch of medical science. But over the years, they are saying that it is holistic method. I mean, you have to have your good food, you have to take care of your health, you have to work out, you have to do many things. So holistic approach, and it is involvement or rather sublimation of many sciences, including many people now say the homeopathy is also good. Ayurveda has also gained a lot of respect. So just tell me that is holistic approach, including yoga, is the only correct way to cure our body?
See, earlier also holistic approach was the best, but later or sooner, I think we have realized now. So it's good that we have realized, and yes, it is good to practice the holistic approach.
Right, Dr. Yadav, lot of talks, advent of social media, every day there are lot of messages, lot of memes, lot of shorts, lot of reels. Now one segment says that okay, you eat oil, then some says no consumption of oil at all. So there are many things going on. Then and someone says that okay, if you eat traditional food and if you're vegan, it's good, and a lot of things are going on, and they include that vegetarian Indian diet and eating before sunset is good. Lot of things are going on. Just tell me, if we include our food habits, is it good for our heart, considering a yoga thing?
Absolutely. There's a lot of studies have been conducted. Diet and cardiovascular disease. And it was found that if you have a diet which is good in good fat, I always say eat fat, but eat good fat. What is good fat? Which is unsaturated fat. Eat less carbohydrate. What carbohydrate? Complex carbohydrate. So if
which means what?
Fruits,
okay,
vegetables.
Okay.
One thing you should always remember, no fat diet is a very harmful diet because your body required essential fatty acid to build up your body. Every cell, every hormone required that. Second important thing what I say, your traditional food is always better. Why? Because your ancestors are taking that food. So your genetic makeup is according to that. If you eat South Indian diet and I am a North Indian, never eaten a South Indian diet, my GI flora, my gut is not adjusted to it.
Because it's according to their climate. They live in hot climate.
That is very good. Eat small amount. Eat frequently. That is the at present the advice. Eat small amount. Eat everything. Eat balanced diet.
Now I come to Acharya ji. As we have been talking about, can we conclude that yoga is really scientific and yoga can also be introduced as a method of health supplement or health improvement?
Definitely, yoga is scientific. If it is not scientific, it could not have existed since last 5,000 years. And the theme of this year, yoga, theme 2025, is yoga for one earth and one health. So that indicates that is the purpose, that integration, holistic approach is quite essential for living healthy. So in this context, I can strongly say that no single healthcare system can cure any disease condition. It may be Ayurveda, it may be homeopathy, it may be Siddha or allopathic medicines. Every system has their own limitations. Today's lifestyle disorders is quite high. Yoga will definitely give a boost to have a quality life and prevent different lifestyle disorders. You have to practice at least 30-40 minutes all the asana and pranayama, then we can get the benefit of yoga.
Dr. Rakesh Yadav, I'll ask you a personal question. Do you do yoga?
Yes,
Okay.
I'm 57-year-old and I'm fit.
Okay.
I do yoga daily.
So we can tell our listeners that
Yes.
a cardiologist is recommending yoga because
absolutely.
he himself is performing it.
Absolutely. I always say yoga is the best thing if you want to make your body fit.
Dr. Varshney, what do you say?
Well, I am a classical example of yoga. I tell you, I had a very high glycemic index almost 2 years back.
What is that? Because a layman wouldn't understand. What is glycemic index?
Sugar.
My HbA1c level was around 8.
Okay.
So just by exercising, taking control of my proper diet and doing yoga, I reduced it to 5.6. And now for the past 2 years, it's 5.6 continuous. And I'm practicing for the past 3 years and I have lost almost 12 kgs.
Okay. So that would mean that one cardiologist and one neurosurgeon, they are recommending
Yes,
yoga because they
definitely,
themselves have been
With
benefited by
diets,
that.
with diet, definitely.
With diet. And what do you mean by diet?
But as sir told, balanced diet. It should be frequent diets, less sugar, less fat.
Acharya, do you do yoga?
Yes, I do practice. We have to follow the recommendations of Ayurveda also. Yoga, the same thing. Ayurveda recommends three things. One is Acharya Rasayana, that is how to behave to others, how to behave to the society. We are social animals, social beings, and how to behave to the society. By doing good behavioral changes, you can reduce your stress to large things. That Acharya Rasayana. Then Dinacharya. Ayurveda advocates what to do, what not to do. Reforms and what to eat, what not to eat. Particularly the dietetic items. And Ayurveda second advocates about Rutucharya. We have in India, the country is blessed with 6 different seasons. To follow all these things, Dinacharya, Rutucharya and Acharya Rasayana and practice yoga, no doubt you will be healthy.
Vaidya Ravinarayan Acharya ji, Director General, CCRAS, Dr. Rakesh Yadav, cardiologist in AIIMS, Dr. Rahul Varshney, neurosurgeon in RML. We all are thankful for you and we think that listeners would definitely have been benefited by this discussion. Thank you very much.
बहुत धन्यवाद.
Thank you.
Scientific basis of yoga and its effect. You were listening this discussion. Participants were Dr. Rakesh Yadav, cardiologist, AIIMS, Dr. Rahul Varshney, neurosurgeon, RML Hospital, Professor Vaidya Ravinarayan Acharya, Director General, Central Council for Research in Ayurvedic Sciences, Ministry of AYUSH, Government of India. Moderator was Mahendra Singh Lalas. Narrated by Neelam Malkania and presented by Dilip Jha. This broadcast came to you from Indraprasth channel of Akashvani, Delhi.